So, welcome to the 50th celebration of AJSM, where we are counting down the top cited articles. My name is Berthe Bø, and on behalf of AJSM Electronia Medial Editorial Board, I'm pleased to present the article from 2010. So this article is titled "Biomechanical Measures During Landing and Postural Stability Predict Second Anterior Cruciate Ligament Injury After Anterior Cruciate Ligament Reconstruction and Return to Sport." And to discuss this article, I'm joined by the first author, Professor Mark Paterno. So hi, Mark. Thank you for joining me today.
Hello, thanks so much for having me.
So about this article, could you give us the background? Why did you perform this study?
Yes, so it was actually in 2000, we started the study about 2006, actually. And the reason we started it was because we started to have a realization in the literature that some subgroups of the population who have ACL reconstruction actually had a much higher second injury risk or second injury rate than the full population of folks having injury. And the population we were most interested in were young athletes, generally teenagers, who were returning to pivoting and cutting sports. So with that realization that the second injury rate was much higher than previously reported, our goal was to try to attempt to identify modifiable risk factors which would be associated with future ACL injury. The hope was that with this information, we could utilize that to have more informed interventions, specifically with rehabilitation postoperatively, to try to help reduce that second ACL injury risk.
So thank you. Yeah, why do you think this paper was so specific, impactful?
Yes, that's a good question. I think part of it was just one of the earlier articles that was published that started to identify modifiable risk factors, which were identifying risk or predicting risk of second ACL injury. And it really opened the conversation to what factors other than current return to sport criteria could be used to identify that risk. Most specifically, this article identified assessments of movement or movement asymmetries, biomechanical measures, and also postural stability. So typically these measures were not at the time being routinely used to assess readiness to return to sport. However, with this article, I believe we started to see a trend towards utilizing quality of movement and movement assessments as important tools to identify readiness to return to sport in hopes of better identifying folks who weren't quite ready so that we could modify some of those factors before we return them to sport.
Thank you very much. I agree, and I think this article was an inspiration for other authors to do work in the same topic. So, do you know anything today that would made you done anything differently back then? It's 12 years ago now.
Yes, it's been some time. And I think there's been quite a few advances in the literature since that time over the last 12 years. So in hindsight, so at the time, when we started this article, the measures or the variables we were looking at were really focused on movement. So biomechanics of movement and also postural stability. And the reason we looked at that was we wanted to look at that in addition to current return to sport measures, which were being used at the time, which was typically quad and hamstring strength, hop testing, and some potentially patient-reported outcome measures, but they were generally focused on, especially IKDC or the COOS were being used at that time. Since that time, there's been much work that's really focused on factors other than factors that were currently measured and those that we've measured, such as psychological readiness to return to sport, fear, and other biopsychosocial factors. In hindsight, it would have been wonderful if we would have included some of those variables in this study to see if there was an interaction between some of the variables we had here and some of those biopsychosocial measures. I think there's been very nice work that's been done since that time, which has really started to highlight the importance of those factors and how they interplay into that return to sport decision-making process. So in hindsight, I would have loved to have had those variables included here, but I do think it just offered opportunity for future work moving forward.
Yeah, thank you. So the conclusion of your study was that altered neuromuscular control of the hip and knee during a dynamic landing task and postural stability deficit after ACL reconstruction are predictors of a second anterior cruciate ligament injury after an athlete is released and returned to sport. Would you still write this conclusion, or is there anything that has changed?
I would. I do think so. I would write that conclusion for the data that was included in that study. I think some of the interesting things about this article, which we've started to see again over the last 12 years, is what was included in this article was any second ACL injury. So that included re-tearing the graft that was on the involved side and contralateral injuries as well. And I think what we're starting to appreciate as we dive even deeper into this topic over the last, again, several 12 years, I think we start to see that there might be independent factors predicting each limb. So predicting the contralateral limb and the ipsilateral limb. And so I think as we continue to look into this is a study that we continue to collect longitudinal data today for long-term outcomes, but in addition to have focused a little more recently to kind of pull some of these factors which were included here, in addition to some of those others that I measured, such as those biopsychosocial factors in to predict. So I think with the data that was included in this study, I would keep my conclusion the same, but I do think probably the suggestions for future research and the future opportunities are very important with this study, because again, it was an early study in this domain of literature. And I think, again, there's been much work that's been done since then and still much more to do to get us to a better place, to identify the best factors, to identify readiness to return to sport.
Thank you so much for your thoughts. And do you have a last comment to new authors who want to do something like this in the same topic?
Yeah, I think just my recommendation would just be persistent. I think, every study doesn't always turn out as you expect initially. And again, this was, we started this study, the ideas of this study kind of grew from some of the primary ACL injury prevention work that was being done at the time. So I think continuing to, be persistent at understanding the current literature and challenging yourself to think about how you can advance that forward. And again, be persistent. Things don't always work the first time, but fortuitously for us, it turned out very well in this case.
So there, Mark, thank you so much for your contribution to this celebration, and happy 50th to AJSM. Thank you.
Thank you.